Hi, it's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to talk to you today about how to move after a knee replacement. Now, some simple things to remember. Avoid crossing your legs or twisting your legs, and try not to bend your knee past 90 degrees when you're sitting in a chair. So when you're sitting in a chair, you want your knee to be at 90 degrees, and you want to avoid putting too much pressure on your knee when transferring from a sitting to a standing position. So you don't want to sit in chairs that are too low. You want to sit in chairs that allow your knee to rest at 90 degrees so that when you try to get up, you're not putting excessive strain on your knee. Okay? After knee replacement, generally you are full weight bearing as tolerated. So you don't have to try to avoid walking on the knee. You are going to walk with an assistive device, which is a cane or a walker, until cleared by your surgeon or your therapist says you no longer need to use it. So know that that is the general standard, that you're going to use a walking aid until you are stable enough to not require it. And generally it's about 6 to 8 weeks that people are using assistive device, but people certainly use it less than that. So don't let the book be your standard. You can certainly be someone who recovers much faster, and sometimes people take a little longer, so just keep that in mind. And there are times when your surgeon might make you partial weight bearing or toe touch weight bearing, which are more challenging weight bearing precautions, because you have to learn how to move completely differently until you are cleared to put full weight on the knee. And sometimes this can be caused by a complication in the surgery, or if you've had a revision and you've had antibiotic spacer put in, or some type of complication after your surgery, putting full weight might not be indicated. So sometimes people get infections after a joint replacement, and the surgery required to clean that out and to revise it requires them to be partial or toe touch for some period. So just know that that's a possibility, but generally speaking, people are full weight bearing after a knee replacement if there's no reason to have a different weight bearing status otherwise. Now, usually if you are an athlete or somebody who does high impact exercises, please have a conversation with your surgeon beforehand so that you guys can have realistic expectations about what you're going to return back to. Okay, people do run after they have knee replacements, but know that running and high impact exercise can make your joint wear out faster, and usually it's about 10 years of life in a prosthetic joint or an artificial joint when you have a replacement. So you want to keep that in mind, that timeline might be a little shorter if you're doing high impact exercises. I've certainly seen people live with their replacements way longer than 10 years. So again, take it with a grain of salt, but that's the general longevity. And people who do high impact exercises can tend to wear it out sooner than that. Now, there was a study done that I mentioned in another video where 4,000 participants were studied. It was a cross-sectional study after they had either hip or knees done, and the people who had knee replacements who returned to running complained they had a 3 times higher complaint of pain, because the knee takes a lot more impact than the hip when we do high impact exercise. So just know this and have a conversation with your doctor beforehand so that you are not met by surprises that you could have talked about before. Okay, but the surgeon ultimately has to give you clearance, so don't say I went and told you to go running. Get the clearance from your surgeon. But if you have a rehab doctor on your team, we certainly partner with your orthopedic surgeon to come up with the best plan to get you back to living life better than you were before, and get back to enjoying the quality of life that you desire, and thriving even beyond your expectations. Okay, so if you are a person who's severely debilitated, who wants to achieve increased mobility, independence, function, and quality of life, or a caregiver to someone who's debilitated in the home setting in the DMV area, I invite you to book an appointment at Freedom Wellness Physiatry, where you'll partner with a physician to help you meet your optimal potential despite your circumstances. FreedomWellnessPhysiatry.com. Physiatry is spelled Physiatry. I look forward to working with you and have a great day. Bye-bye.